And out front now is Matt Klein. He is a state senator in Minnesota, also a doctor, and he lost his father-in-law to coronavirus earlier this month. And Senator Klein, I am sorry for your loss. I know he was very dear to you and your children. You're here tonight because of his experience with this virus, both how he viewed it and how he died from it. I know it is something that you wanted to share, that he had believed coming into it, that it was a hoax. Tell me about the conversations you had with him about the pandemic.
Well, first of all, let me say my father-in-law was a giant of a man. He was a hero of our large family and a hero of his community. He was a blue ribbon grandpa who was vigorous and built a log cabin all with his own hands and built a small business into a large business all by himself. He was skeptical that the coronavirus was a Democratic exaggeration. He was skeptical and thought masks and distancing were a little weird. Like a lot of families, I'm a Democratic senator. He was a lifelong Republican. Like a lot of families these days, we had passionate political disagreements. And unfortunately, the coronavirus caught up with him.
And as you say, he was a Trump supporter, and you talked about him, you talked with him about wearing masks, right? As a doctor, you talked to him about that. You talked to him about social distancing. What did he say to you?
Yeah, so this is a symptom of the times. We always had a good relationship, and I know he loved me and I loved him, and he trusted me as a doctor. I think he trusted me as a son-in-law. But politics sometimes can supersede those questions in today's day and age. And I think he was suspicious of the agenda as a Democrat and skeptical. I would advise him, to wear masks and to distance socially and to follow the usual regulations. And I think he was skeptical of those recommendations.
And so then what happened? How did he end up getting it?
Yeah, so he was over Labor Day in Wisconsin. They had a very large outbreak there. The court struck down their governor's executive orders suggesting public health measures. And the culture up there was very open. The people were largely not masked. They were crowded into public spaces like bars and restaurants. We believe that my father-in-law caught the coronavirus over Labor Day in northern Wisconsin. He, became very fulminantly ill. His granddaughter drove him to the hospital and dropped him off, and he walked in, and that was the last that our family ever saw of him. He became very fulminantly ill, was on a ventilator, and we said goodbye to him over the telephone, and he died on October 7th.
So you say he was in Wisconsin. Of course, President Trump was in Wisconsin this weekend, and he was talking, doctor, about why cases and deaths are so high in the United States. And he made an allegation that doctors and hospitals are inflating the numbers, the death numbers from coronavirus, to get more money. I just wanted to play for you what he said, doctor.
Doctors get more money and hospitals get more money. Think of this incentive. So some countries do it differently. If somebody is very sick with a bad heart, they die of COVID, they don't get reported as COVID. So then you wonder, gee, I wonder why their cases are so low. This country and their reporting systems are really not doing it right.
So I believe after this interview, you're going to the hospital to treat patients, right? So when you hear this as a doctor, as someone who's now lost your father-in-law, in part because of his belief in some of the things the president said about COVID. What do you think when you hear the president say this, that you're artificially inflating COVID deaths to get paid more money?
Yeah, well, look, Erin, this is a president who called our fallen veterans losers and suckers and didn't understand what was in it for them. I have no doubt that he would require a financial incentive to go care for someone who was sick or who was dying. And he clearly doesn't have an understanding of what sacrifice and duty mean, but we do, the people who go into the shift that I'm about to go into at Hennepin County Medical Center and care for human beings. We know why we're there, and we're doing it for the right reasons. What was most offensive about that statement, Erin, was that he made it in Wisconsin, literally on the grave of my father-in-law, at a large public event where, once again, social distancing was not practiced. And I felt it was just an additional slap into the face to the causes that led to my father-in-law's demise.
And what is the lesson you want people to learn from what happened to your father-in-law?
Look, like I said, I loved my father-in-law, and I know he loved me. And like a lot of families these days, we had strong political differences. But somehow public health cannot be one of those political differences. We got to trust that we want to care for each other and we want to do the right thing for each other. We're not out to trick people. We're not out to, impose a political agenda. We just want to get through this together, be safe and healthy as a country.
All right. Well, I appreciate your time. Dr. Klein, Senator Klein, thank you.
Thank you, Erin.